Assalamualaikum, welcome to my channel. Hope you guys are well. Today's discussion is all about the basic anatomy of CSF. What is CSF? CSF is clear colorless body fluid that is found in the tissue that surrounds the brain and the spinal cord. The total quantity of CSF is about 150 ml and the pressure is 60 to 100 millimeter of water. Now we will know about the formation of CSF. CSF is mainly from the choroid plexus of the lateral ventricles. This is the lateral ventricles. These are two lateral ventricles. So CSF is mainly formed in the choroid plexus of the lateral ventricles and also partly from the choroid plexus of the third and fourth ventricle. This is the third ventricle and this is the fourth ventricle. Now about the circulation of CSF. CSF is mainly from the lateral ventricles of the choroid plexus. So from their lateral ventricles it goes to the third ventricles via foramen of Monro. This is the foramen of Monro. Its other name is interventricular foramina. From third ventricle it goes to the fourth ventricle via aqueduct of Sylvius. This is the aqueduct of Sylvius. And from fourth ventricle it goes to the central canal of the spinal cord and to the subarachnoid space via foramen of Laschka and foramen of Magendie. This is the foramen of Laschka and this is the foramen of Magendie. So this is the pathway of cerebrospinal fluid. And now about the absorption of the CSF. CSF absorbed through the arachnoid villi and the granulation and drained into the cranial venous sinuses. It also absorbed partly by the perineural lymphatics around the first, second and eighth cranial nerves and by the veins related to the spinal nerves. Now about the functions of the CSF. The main function of CSF is protection of the brain and nourishment of the neurons. CSF decreases the sudden pressure or forces on delicate nervous tissue and neurons cannot live without oxygen and glucose more than 3 to 4 minutes. And this CSF constantly provides oxygen and glucose to the neurons. And CSF is no brain barrier, so drugs can be reach the neurons, and there are blood CSF barrier, so there are no antibodies in the CNS, making infection of the brain is very serious. CSF can be obtained by the lumbar puncture, cisternal puncture and the ventricular puncture. Lumbar puncture is the easiest method and it is commonly used. It is done by the passing a needle in the interspace between the third and the fourth lumbar spines. Biochemical analysis of CSF is diagnostic value in various diseases. So this is all about today's discussion on basic anatomy of cerebrospinal fluid. Hope you guys are understanding my videos. If you guys want to know about any topic, then you can comment me. Inshallah, I will upload video on that topic. So guys, take care. Allah Hafiz.